This is the first of many updates that we propose to do to support practices in returning to providing dental services in a safe environment both for our dental teams and our patients. What is absolutely clear is that we need to plan the future because it is evident that we will not be returning to the same level of service as pre-COVID-19 days. There are a number of things that we need to look through before we can decide how best to return to practice. The first element that I suggest practices look at is to actually reflect on where they find themselves today. This will include looking at the teams that you currently retain, equally what the impact on your practice has been, and where do you find yourself in terms of patients that require care and treatment going forward. We need to take this opportunity before returning to work to educate not only our patients but also our teams. Patients will require education in terms of the services that are available in the immediate and short term, and equally what infection control procedures are present to minimize the risk of any COVID-19 infection. Equally, we need to make sure that our staff understand the implications of what has happened so that they are equally aware of what is required when you return to work. Change is inevitable post-COVID-19 pandemic, and the changes need to be considered both in the immediate term and short term. We have to accept change is inevitable, and we have to understand what change means for our practices. What does it mean for our patients, our teams, and for principals in terms of revenue streams and potentially returning to the days of reasonable profitability. We also have to consider, if we are NHS providers, what potential contract changes may be introduced to help us through this very difficult period. We have to consider operationally what this means for us when we return to work. What standard operating procedures are we going to be required to follow, and how does this affect both infection control and PPE requirements within the practice? We also need to understand operationally what this means for patient flow and traffic of patients through our practice. We equally have to understand what volume of patients we will be able to see as we return to practice. We need to understand prioritizing patients in terms of accessing care and how we manage the various groups, namely the vulnerable and shielded adults, and equally those that require emergency treatment or find themselves still in open course of treatment. We will not return to the days of seeing 20, 30 patients a day, and patient flow is very important as well as prioritizing care. We need to understand the expectations when we return back to practice. Are we going to be expected to provide emergency services only, or are we going to wider ranges of services in the medium term? There needs to be an understanding as to whether we will provide non-AGB procedures and the implications of that, and also whether we provide AGP procedures, which will have different expectations. Clearly, we need to understand as NHS providers what that means from a contracting perspective to ensure that we will not be at risk of losing contract value. Essentially, we need to refresh and restart our services with a considerable amount of thought in terms of patient care, team development, and understanding the differing operational aspects of our practices. This also means training, education, and support for patients and the dental team during this very difficult period. It is going to be a challenge to understand the operational procedures that we will be able to manage and equally be expected to provide. There are many additional things that we have to consider, and that is going to be how best we manage our appointment books and how we use IT technology in the new world post-COVID-19. We need to consider how best we can use remote IT services to provide remote consultations and triage services for emergency patients. There may be an opportunity to consider how best we use IT to distribute patient education and patient information. There are many things we have to consider both as NHS and private providers, and for NHS providers this would also be determined by the commissioning arrangements that are put into place by NHS England. There are significant discussions around a change of NHS contract. We also need to decide as private providers how best we look to increase and bring back the revenue that we had prior to COVID-19 and whether we are dependent on an item of service practice or alternatively on a practice plan basis. There are many aspects that need to be considered before we're able to return to practice to ensure not only a safe return but equally a financially rewarding return. If you feel that we can be of any assistance to you in planning the future post COVID-19, let's chat and I can be contacted via my website. I wish you well during these very difficult times and hope that you will be able to return in a safe way and make your practices profitable and equally restore faith within the population as to the quality of our dental services. Thank you.